special guest tonight. Dr.
Mhm.
Eldridge Taylor was one of my first, if not the first, mentor that I had, or
Mm.
my at the beginning of my renaissance from a real doctor to going over to where we are now in the dark side. Dr. Eldridge Taylor um, is a board certified physician educator with, I hate to say decades of experience, but that's
Yeah.
decades of experience. If does anybody read go through any of the emails that I send out? On the in the email, there's actually a video of Dr. Taylor from about 20 years ago, and he has a little bit more hair and a mustache. Same
Yeah,
voice though,
yeah,
um, and
yeah.
he is really to me he and Dr. Byerly piped up just a little few minutes ago also. He was one one of the ones who sort of turned the light on for me anyway.
Yeah. Yeah.
So it's his fault that I've been annoying you for the last 5 years on these webinars, because
Yeah.
otherwise I'd be driving an Uber.
Yeah.
So Dr. Taylor is known for his work reframing hormone imbalance through tissue level signaling and stress dominance rather than isolated lab values. And I know he's big on saliva testing. He's lectured
Yeah.
internationally as a regular contributor on View Medi, where his work focuses on restoring clinical clarity when conventional testing fails to explain persistent symptoms. He was such a sort of hero to me. When I contacted him through the View Medi sort of portal there, I was a little sort of hesitant, was I worthy of his attention here?
Yeah.
So
Yeah.
so the video he sent a video that it wasn't in the form that I could put in the email, but there is a link to it. And all right, I do have a bunch. I watched it 4 times because there's a couple things in there that
Mm.
I have some questions on. So
Okay.
I'm really anxious to hear what you have to say. That he's going to be speaking about stress dominance. Um,
Yeah.
and most of us know that stress pretty much dominates our lives. So, Dr.
Mm.
Taylor, the floor is yours.
All right.
Usually what we do is you know do your presentation. Um, hold questions to the end unless you want them in
Okay.
between. And then we do a Q&A thing also. Is everybody I'm getting can everybody hear? I'm home tonight. I'm not in the office because we had snow here and
I
I
hear.
can hear okay.
everybody here okay?
I hear.
Okay. Okay.
I can
All right,
hear
Dr.
okay.
Taylor.
Okay. All right. Well, hey, I kind of feel like I'm preaching to the choir, because, I know you get, if you're here, like I say, you're of like mind. And I will be very honest with you, Dr. Nario. I don't have all of the RCT and all of that stuff. I am a simple, simple guy. And what I'm going to present today is very simple. Uh, I'll tell you, I don't do any new research. I don't have a lab. I don't have any of that. All I do is try to apply physiology. And that's just what I do. I talk about physiology. And I really didn't know the impact that I had 20 years ago, and all of these people are talking about that I got them started. I really didn't know that. I was just trying to tell you what was happening in my practice and what made me like medicine again, and somehow it resonated with people. And so, but also what I found out is that, yeah, I am old. And the people who heard me 20 years ago, uh, they're retired, or they're whatever. And there's a whole new set of doctors like Dr. Nario who don't know who the hell I am. And they don't know what I talk about or anything. So, and I also learned that there's a whole new generation of patients who don't have any idea about hormones. And I see all this stuff on TikTok and all this, and it's just totally crazy stuff. And, I did this when it wasn't popular. And now it's popular and everybody's jumping on the bandwagon and they're not taking the time to really understand just the basics. And that's really all I talk about. So, again, this may be boring for some of you guys, but I'm just going to tell you, this is all I know. I don't know any. This is what I know, and I'll try to express it as best as I can. and I'll try and clear up any misperceptions or whatever, and we'll just have a discussion. And I will be honest with you, I am a person who has been doing saliva testing for 30 years. And for me, it has provided clarity. And I'm not here to argue this. I'm just telling you this is what I do. Okay? Okay? And you can ask questions later. But how do I show my slides? What do I need to do to share my screen?
Bottom there, at the bottom there, there should be a share
Oh yeah,
button,
I
a little
got it.
green thing there.
Yeah, let me pull this up, and then I'll tell it I want to share that. All right, and let me
There
get
you
this
go.
out of the way,
Yeah. Um,
and let me do
if you go
this.
slideshow and then
Can you
it'll,
see it?
yeah, yeah, we see it fine.
Okay,
Yeah.
let me go back. All right, you guys can see this.
Yeah, that's fine. That's great.
And if you want, I don't mind. You can stop me. I can't. For some reason I made this where I can't see you guys, so I can't see your faces. But if you have a question, Dr. Clearfield, if you can interrupt me if you see some hands raised or whatever,
Sure.
and
Hmm.
we'll go from there. All right.
Yep.
So here's the stress connection. So I'll tell you 25 years ago how I got in this. I'm an OBGYN by training. And I went to Emory University and I did OBGYN just like I was taught. I gave birth control pills to the young women and the older women. I asked them, do you have a uterus? And I gave them Primin if they didn't have a uterus, and I gave them Provera if they had a uterus, and that's what I did. And if that didn't work, we cut out the uterus, we cut out the ovaries, and then when that was all over with, and they still had symptoms, we sent them to the psychiatrist. And that sounds crazy, but that's what I was taught. And they didn't say it, but they say see one, do one, teach one. And so that's what I saw. That's what I did, and that's what I taught until my wife had issues. And then when my wife had issues, I said, wait a minute. I'm doing this because my wife was 35, she was irritable, all this. So I gave her birth control pills. That wasn't working. And my wife's a psychiatrist. And so, anyway, to make a long story short, it just so happened that during this time, a patient asked me if I knew anything about progesterone and saliva testing. And I said no. And she gave me a tape by John Lee. And I listened to, I didn't listen to the tape because I was like, how can this patient tell me anything? And my wife listened to the tape and she said, this guy's talking about me. I listened to the tape and that day my life changed because I finally understood hormones. When he started talking about progesterone, he started talking about saliva testing, all of a sudden everything made sense to me. So we wrote a book called Are Your Hormones Making You Sick? Talking about how you measure hormones and how you treat it and how you follow it. And I did that for about 2 or 3 years. And then I was going to conferences. I heard people talk about stress. And I said, this is the reason why, even though I know about estrogen, progesterone, and testosterone, all of that stuff, some of these patients still have all of these symptoms. And so, what is going on? So, that's when we wrote the book called The Stress Connection. And that's connecting the link between stress, hormone dysfunction, and immune suppression. And that's what we're going to talk about today because I think you have to start here to connect all of these dots. All right. So, this is kind of my little thing. You know how patients, you have patients who come in and you have this long questionnaire and they check off everything. Okay, I mean everything's marked off. And so then you go into the room and they say, "Hey, look, doc, I don't know what's wrong with me, but I'm lightheaded and I have insomnia and then, I also have PMS and I have headaches and then I have muscle pains and spasms, and then I have epigastric pain, and I have food and other allergies. I have this dyspepsia and I have this diarrhea. I'm constipated sometimes. And you say, well, all right, Mr. Jones, that sounds awful. But wait a minute, doc, I also have excessive fatigue, and then I'm nervous, I'm irritable, I have mental depression, I can't concentrate, I'm everything, I'm anxious about everything, I have this weakness, I'm frustrated, I got these cravings, and you say, oh my God, what in I only have 10, 15 minutes to talk to this lady, and she's telling me all these things. What in the heck am I going to do? Well, here's what you do. You order the FSH, the thyroid, the CBC, the SMA7, the cholesterol, the ANA. And you know that all of those tests are going to be normal because you've seen Miss Jones, I don't know how many times, and she always comes in the same complaint. So you order those tests. Now, it doesn't do anything for the situation except it gets you out of the room, and you know it's going to take about 2 or 3 weeks to get all of these tests done. And so then the patient comes back and she says, "Okay, doc, I know something must be wrong." And you say, "I'm sorry, Miss Jones, but all your tests are normal." Then you say, "Okay." She comes back and tells you all of those symptoms again. And you say, "Wait, Mr. Jones, now we're going to do an ultrasound, CT scan, an upper GI, endoscope, laparoscope." And you know all of those are going to be normal, but it buys you at least 4 weeks because it takes a long time to schedule an ultrasound, a CT scan, and an upper GI. And so then she comes back. And then the only thing you can do now is you've got to write a prescription because that's the only way you're going to get out of that room. All right. So then you're going to give her all these drugs, and you're gonna give her the antidepressant, you're gonna give her the cholesterol medication, you're gonna give her the estrogen. If she doesn't have a uterus, you may give her some progesterone. You're gonna do all that stuff because that's what is popular now. Everybody's getting pellets and they think testosterone is the energy thing. All of this, but the problem with popular thinking is that it doesn't require you to think at all. It's easy to do what other people do, and you hope that they thought it out. And what happens is we think that the American College of OBGYN has thought, and not you guys, but the people in the line, they think the American College of OBGYN has figured it out. They think that the American Menopause Society has figured it out. They think that the AOA has figured it out. No, they think the pharmaceutical companies have figured it out. None of them have figured it out in the patient's benefit or in your benefit. So I am encouraging, and this, I'll tell you what got me started on this is by John Maxwell. I read a book over 35 years ago called Thinking for a Change. And that's what this is about, is that I stopped letting other people tell me what to do. I started thinking for myself. And that is the problem, I think, in medicine. We give over our authority to you know, these so-called organizations. And we have to start thinking for ourselves. And again, not you guys. I'm talking about medicine in whole. We have to start thinking for ourselves. All right. So now here's the deal. So you know all those symptoms that that lady had. So then, if you don't have a real diagnosis for them, because the patient doesn't have a disease, because we have been taught to identify and diagnose diseases. So if they don't fit into a disease category, we made up these names. So, I talk about these non-diagnoses that patients are given. And one is called chronic fatigue. And you say, well, how do you diagnose chronic fatigue? Well, the way you diagnose chronic fatigue is a patient has to come in and say, "Doc, I'm tired all the time." And you say she has chronic fatigue. Well, all you did was, and again, I know I'm preaching to the choir, but here's what happens. All you did is regurgitate what the patient said. She said, "I'm tired all the time." Chronic means all the time, and fatigue means tired. And so, but patients, they get labeled this and they go around and tell everybody how they have chronic fatigue and they make all these excuses why they can't live their lives because somebody told them they had chronic fatigue. And then people wear the badge of fibromyalgia. What does fibromyalgia mean? How do you diagnose that? The patient has to come in and say, "All of my muscles and joints hurt all the time." So what does fibro mean? It means fibrous tissue, which is your joint. Myo is for muscle, and algia means pain. So she said, "My muscles and joints hurt," and you said, "Your muscles and joints hurt." And she goes out and says, "My doctor says I had fibromyalgia." And then she sees all of these commercials about, if you have fibromyalgia, you should take this. And they start taking it, and it doesn't help. And then being on TikTok, and I'm talking about hormones, you can't believe how many people label themselves as PCOS and have no idea what PCOS is. And they say, "My doctor told me I had PCOS." And I said, "When did they tell you that?" "Well, when I was 10 years old." I said, "You didn't have PCOS. That was puberty." PCOS is irregular ovulation or anovulation. So polycystic ovary means that you have a lot of cysts, those cysts, multiple ones, and it is making estrogen. You're not ovulating, so you're not making progesterone. So really, you're just estrogen dominant or progesterone deficient. you do not, PCOS is not a diagnosis. Okay. Attention deficit and hyperactivity disorder. What does that mean? A patient has to come in and say, I can't pay attention. I can't focus. Well, that's attention deficit just means you can't pay attention. That's what the patient just said. And the patient comes in and says, hey, I have diarrhea, constipation, everything bothers, it irritates my bowel. And we tell them they have irritable bowel. And then the patient says, my emotions go up and down. We say, well, you're bipolar, you're happy and sad. We're just describing what the patient has already told us, but the patient takes this as some kind of scarlet letter that they tell every doc, and every doc takes this diagnosis or this non-diagnosis and they base their decisions on that. And so patients don't ever get better because they don't know why they're tired, why their muscles hurt, why they don't ovulate, why they can't focus, why their bowel is not working, why are their emotions all up and down. That's what the patient wants to know. Why is this happening? So I believe it's all stress. Now, also, I told you I read that book, Thinking for a Change, and then about that time, because this is a study done in 2002, if you see this, it said 75 to 90% of all visits to primary care physicians are for stress-related complaints or disorders. So when I saw that, I said, look, if 75 to 90% of my patients had diabetes or hypertension or cancer, I would try and learn everything I could about diabetes, hypertension, and cancer. So if 75 to 90% of all the visits for primary care physicians are for stress-related complaints or disorders, I need to learn how to identify, measure, and manage stress. Because that's what we do for hypertension and diabetes, right? We measure the blood sugar, we measure their blood pressure. And well, first we identify that there may be an issue. Okay. So we identify it by doing the correct test. Then we measure it and then we manage it. Okay. And so you can't, and that's going to be a slide that comes up with, you can't manage what you cannot measure. So I said, I am going to learn, I am going to be an expert on stress because I'll be able to help 75 to 90% of my patients. And that was in 2002. What do you think what do you think the statistics are now? I think it's 90 to 99% of all visits are due to stress-related complaints or disorders in this stressful environment that we see ourselves in. Okay, and I'm not just talking about political or whatever. I'm talking about the environmental stressors, the physical stressors, the emotional stressors. All of those, your body only sees one big stress. It doesn't matter what the stress is, if it disturbs homeostasis in any way, it is a stress to the body. All right. Now, this is stress physiology, and this is why I called it the stress connection, because stress is involved with every organ system in your body. Every organ system is is affected by stress. So when you're under stress, you have headaches, feelings of despair. You know, we know all that. This is why we have so much mental illness in our society. All right. It affects the skin. All right. It affects the muscles. It affects the heart. You see what I'm saying? So this is an important issue. So I said, so I'll tell you in my clinical practice, the fact that I decided to become an expert in stress has greatly changed the outcomes in my patient and has greatly increased my ability to understand and relate to patients and to help them understand themselves and be a part of their recovery. All right. So this is another, I think, a profound statement. We have to think differently. We cannot solve our problems with the same thinking we used when we created them. And I see this happening right now. I know you put something on there about when I talked about like lifting the black box warning on hormones. And I'm like, oh my God, we're going to do the same thing over again. We're going to give everybody estrogen again. We're going to have to do another study like the Women's Health Initiative, and we're going to do this all over again. And I'm saying we have to start thinking differently. We always think that we have to have a new study to tell us what physiology has been telling us for thousands of years. So I don't care about new studies. I really don't. Okay. When I'm basing things on physiology, I don't care about the latest study. because physiology is physiology and we don't have to prove physiology. And we can debate that if you want, but I'm telling you, when you know the basics, when when a basketball player loses his shooting rhythm, the coach goes out there and says, we have to go back to the basics. We don't need to learn anything new. You have lost your rhythm on your shot. We're going to go over the basics. Where do you stand? How do you place your feet? Where is your arm? Where is your so that's where we've got to do it. What this is what we've got to do. And you guys are probably already there, like I said, but I'm trying to this is kind of my like my last hurrah. This is my last generation that I'm going to be able to affect. So I am going full speed ahead. So this is what I'm talking about. This is what Socrates says. Like I said, I don't have any new information for you guys. None. I don't have any new studies. I don't have any of that. But I do remember. I remember basic physiology, and that's what learning is all about. It's about remembering. It's not about the it's and I know like you're talking about ayahuasca and all that stuff. That's something different. Yeah, you need randomized controlled trials on that. No doubt about it. But basic physiology does not have to be reproven, I don't think. Okay, that's my opinion. Yeah, it's my opinion. All right. So this is the normal stress response. That's why I told you it doesn't matter what the stress is. Okay. Um, if it's physical, whether it's toxic exposure, light cycle disruption, which means you're up at 2 or 3 o'clock in the morning, a food intolerance that you don't even know about, temperature extremes, trauma, physiologic glucose dysregulation. All of these are stressors, and they all do the same thing. They initially stimulate the sympathetic nervous system, saying, "Hey, look, we are out of balance. Something is going on here. Something is affecting our homeostasis." So it sends out a signal. It tells the HP axis, "Hey, we need more energy. This is a stress. We've got to right this ship." And so it sends out cortisol. Cortisol mobilizes glucose, so you have energy to deal with that stress, deal with so you can adapt to this stressor. Okay, so that you can increase your detoxification, so that you can try and change your rhythm so that you can sleep at night. So it's trying to cause inflammation to tell you that you're eating food that you shouldn't be eating. So it's trying to get you to overcome this stress. All right. Now the problem is these are not things that come and go. These things can be long standing. And this is a short-term design system. And this is another book. I tell you about these foundational books. Why Zebras Don't Get Ulcers by Robert Sapolsky. And he just wrote a new book called Behave. And it's just talking about how the nervous system signals your behavior. What happens a second before you make a decision? What happens a week before you make a decision? It's a very interesting book. But this is the first book that I read, Why Zebras Don't Get Ulcers. And zebras don't get ulcers because they know that this is a short-term thing. Zebras sit around and they just wait. I just left. I've been on 2 safaris in Africa, and you see how the animals, they sit around and they eat and they relax and they graze. But the minute a predator comes, man, all of these animals can run like the wind because they sit around in a parasympathetic state, storing up energy, storing up their resilience. But time a predator comes, man, it is a 40 mile an hour. I mean, even elephants can run like the wind. All right. Why? Because they know how to use the stress response. Because when it is time for them to run, they don't care about reproduction. So they shut off their hormones. They don't care about insulin, about energy storage. They want that glucose in the bloodstream so it can go to the muscles because you don't even need insulin for glucose to go into the muscles. It does not want you to waste energy on anything other than running and fighting, so it shuts down your thyroid. It says we don't have enough energy to be absorbing anything. Here's what we need to do. We need to do two things. We need to stop digestion and we need to empty out the colon. So it makes you have diarrhea and then it stops everything upstream. And then we don't want to waste water. We want to hold on to water because if we get injured and and we're bleeding, we want to have an increased intravascular volume. So it's harder for us to bleed to death. And the last thing you want to do, if you're in the middle of a short-term race, the last thing you want to do is fall asleep. So here's how it works with the zebras. If they are being chased by a predator, two things will happen. They will either win the race or they will lose the race. If they win the race, they say, "Oh my God, I outran the lion. Thank goodness. Let me go back to grazing because I got to get ready for the next time that this guy comes." All right. Or if he loses the race, the zebra's dead, but both of those are short-term stress responses. Either it's going to win the race and it's going to say, thank goodness, or it's going to be dead and no more stress. So that's how it's supposed to work. But this is the problem. We have long-term stressors, and when cortisol is the main goal, it skips the mineral corticoids. You don't have any aldosterone, so you don't have any good fluid balance, and it shuts off all of these hormones. All right. So this is the problem. When you have cortisol involved, it's very hard to balance hormones because it's disrupting the whole system. I don't know where that came from. Where did these marks come from? Did I do that? All right. So basic management principle. You cannot manage what you cannot measure. So if I'm going to be an expert in stress, I have to know how to measure it if I'm going to be able to manage it. Because when somebody says, "Hey, you need to manage your stress better," well, you tell them, well, you say, "Wait a minute. How can I manage it? How bad is it? How do I know if it's better? What is it doing to me?" We have to be able to measure it. All right. So how do you measure it? We conclude that salivary cortisol measurements are an excellent index of plasma-free cortisol. They circumvent the physiological, pathological, and pharmacological changes due to corticosteroid binding globulin alterations and offer a practical approach to assess pituitary adrenal function. Okay, so let's just start here. Why do I use saliva testing? Well, if you look at endocrinology, cortisol is the gold standard. Saliva testing is the gold standard for cortisol, according to the endocrinologist. All right, because it bypasses the corticosteroid binding globulin. So now all of these are steroid hormones, right? They all come from the same place. Let's go back. They all come from cholesterol, so they're all fat soluble. All of these are, right? So fat soluble hormones are more likely to be in the tissue than they are to be in the blood because in the blood they are bound by sex hormone binding globulin and corticosteroid binding globulin. All right. So saliva testing bypasses the binding globulin so you know what is actually in the tissue. So I see people trying to use blood and calculate out how much sex hormone binding globulin there is and then looking at the free amount. But here's the problem. These are lipophilic hormones. They don't just go in and out of the tissue. The extracellular space in the tissue is also fat soluble. So just because there was free hormone that got delivered yesterday, it doesn't mean that that free hormone left the next day. That free hormone can still be in the tissue. So that's why you have to know how much is in the tissue, how much is accumulating in the tissue, not just how much free hormone is in the blood. And when you do all of those calculations, it still does not give you the real tissue concentration. So the blood is a delivery, the urine is the metabolites, and the saliva is the tissue concentration. And because these hormones go into the cell, okay, then that is where the action is. All right. They go through passive diffusion. And I can give you a 3 hour lecture on saliva testing. Okay. But I will tell you, and look, I'm not here to debate saliva testing. I really am not. I'm just telling you, this is the information that I have used and I have based my practice on for almost 30 years. And I will tell you again, it's made me where I now understand physiology because I've seen it with my own eyes over the last 30 years. All right. So cortisol comes in a rhythm. Okay, and so think of cortisol as glucose regulation. Okay, glucose supply. So what's supposed to happen? You're supposed to have a good night's sleep, you rest, recover. This is like those animals that sit around and just eat and they don't worry about anything. So this is what's supposed to happen at night. You recuperate, you regenerate. All of the things that you did, all the supplements and all that stuff, they have to be incorporated at night. And then what happens in the morning, you should get a burst of cortisol and you wake up, you're ready to go. And then your energy kind of dissipates over the course of the day. And then you eat lunch and you get a little more energy. And then you get tired and then you go to sleep and you sleep through the night and you dream and you wake up refreshed. That is what's supposed to happen. All right. So this is what happens with stress. Now, stress is not all bad. Okay. You don't want to have low stress because then you just sleep your life away. You need to have something, you need to have a reason to wake up in the morning. And so you can want to be alert. You need to have a reason to wake up. And then you want to have something that really motivates you. And that's when you are at your optimal performance. And this is where everybody wants to be. But usually what happens is we overdo it. We push too hard. We don't get enough sleep. We don't eat right. We stay at the office longer than we should. We open up another practice. We have to, hire some more staff. We have to fire some staff. We're worried about reimbursement. Is the insurance company going? All of this stuff, and we end up over here. Okay, and then we just get disorganized, and we just have more and more stress, and that's just how life is. Now, and again, I may be preaching to the choir, but this is something I have been trying to get over for years. And I actually went, I'll tell you that story in a minute. So, is how stress affects the thyroid. So, activation of the HPA axis is associated with decreased production of thyroid stimulating hormone. So, I just want to stop right there. So, when you are under stress, it blocks TSH. Okay. So it blocks TSH. And what do all, I won't say, what do all, well, I will say it. All endocrinologists only look at the TSH. Okay. They say, okay, if the TSH is below 5, you are euthyroid. And we all know that's not right. But anyway, that's what they look. But let's look at this. Inhibition of the conversion of relatively inactive T4 to the more biologically active T3 in peripheral tissues of euthyroid 6 syndrome. So stress blocks T4 to T3 conversion. We know that's the active form, but it also blocks TSH. So when stress is involved, you can't only look at TSH to tell if a person is hypothyroid. You have to look at how much free T3 they have and how much reverse T3 they have. Because even if they have a normal amount of free T3, if their reverse T3 is elevated, reverse T3 blocks the receptor for T3. So you need to know all of this information to evaluate someone's thyroid. You need to know what their stress response, what their stress is, what their stress cortisol curve is, and you need to know what their reverse T3 is. You need to know what their T3 is. You need to know what T4 is. And we have all these people who are on level thyroxine, which is T4, but if they don't have zinc and selenium, if they are under stress, it is not going to convert to free T3. So we have to, and I think I have this. No. Well, I'll tell you, I went to the Endocrinology Society in Florida, and I didn't want to go, but a doctor wanted me to go. And I said, endocrinologist, and I hope there's no endocrinologist on here. I hope you're a reformed endocrinologist. So I went and spoke to them, and I just went over this part, and it was about 50 people there. And so I did this talk and I said, for first, I said, I'm an OBGYN, and 25 of them left. So then the 25 that was there, I did this and I said, I want to tell you something. TSH may not be the best indicator of thyroid function. And it was like I sucked all the air out of the room. They said, it was like I had blasphemed, because I said something bad about TSH. And then I showed them in their own endocrinology book. This is where I got this from. It's from the Journal of Endocrinology. That's where I got all of this from. And I told them, this is from your textbook. And they still didn't want to hear it. So that's what we talk about, see one, do one, teach one, is that it's so hard to get new information into doctors because they're so fixated on what they've always done. And that's why you're getting kicked out of everything. And that's why I did that get out of line, because everybody wants you to go back into that popular thinking because it makes them uncomfortable when you say something that goes against their hardcore beliefs. Okay. And I tell you, belief is a hard thing to break. It really is. It's a hard thing to break. So, really, stress is about allocating energy. Okay. Because when you have homeostasis, when you're those animals sitting around, eating, relaxing, sleeping, they have full function of their cortex, their functioning brain. This the cortex and the reproductive organs take up a lot of energy. So if something is going on, so when you're relaxed, your frontal cortex is working, so you can make good decisions. Your immune system is working, so it's less likely you're going to be sick. So you can be at your highest level of performance. You're going to have nutrient absorption, and you know what happens is that it shuts down digestion. So it says, hey, we don't have enough energy to do that. So, but two things happen. You don't digest your food, but also you have to come back to the stomach to pick up nutrients. And so now you have a double deficiency. You're not digesting anything. And now when you need more energy, nothing is working. You know, your digestion is not working. So you can't pick up any nutrients. So that increases your fatigue. And then reproduction, you're like, you can't waste a lot of energy chasing women and wasting all this energy on sex. So we're going to shut off your libido totally. And we have all got to go. We have to send all our energy to our muscles because we have to fight or we have to run. And so everything else gets suppressed. So that's why I'm talking about sympathetic dominance. And I'll tell you, if you symptom chase after all of this stuff, this is why people are on all these different medications and are on, having all these diagnostic tests and all of these things and getting scopes stuck up their butt and down their throat, looking for, irritable bowel syndrome. And it all starts from stress. Okay. All right. So the unified model of stress dominance, you have GnRH suppression, so it shuts down your reproductive system. You have TSH inhibition and 5' deiodinase block, so you have metabolic hibernation. You get vagal withdrawal and vascular shunting. I don't know what happened to my slides. And you get gut and immune compromise, and then you get frontal cortex inhibition, you get loss of cognitive autonomy. So there's a zero-sum game. You cannot treat the symptoms, low hormones, gut dysfunction, brain fog without addressing the upstream allocation shift caused by the HPA axis. So this is what I want to talk about real quickly. I feel like a lot of the problems that doctors are facing, and I know the doctors talk about I used to hate medicine, and so I'm trying to understand docs, okay, and why they aren't willing to change. And I really think it's because they have so much stress, okay? And so when you have a lot of stress and all of this is turned off, your brain doesn't work, your gut doesn't work. So what happens is when you lose that internal direction, the frontal lobe generates motivation and independent decision making. When it's atrophied by stress, the internal locus of control diminishes. So when you don't feel like you can think for yourself, or you don't have enough energy, or you're just so stressed you can't really think, this is why you go into the caterpillar land, because without executive cognitive function, the brain defaults to group consensus or rigid protocols to ensure safety. So that's why they go and say, hey, it's FDA said this, or the American College of OBGYN said that, even when it doesn't make any sense. We feel safe because somebody else thought it out, and I'm just going to do what they said. They seem to be the ruling authority. They seem to know what they're doing. I'm confused. I don't know what's going on. So let me just do what everybody else is doing. And that is what the standard of care is. The standard of care says what are most reasonable physicians doing in your area? And it doesn't matter if it's right or wrong. So that's why the pharmaceutical companies say, hey, look, all we got to do is get enough doctors to do what we ask them to do, and that will become the standard of care. And what they do is they get on the television and they have all these commercials and they say, "Ask your doctor about this drug." If enough people ask the doctor about the drug, then the doctor is going to ask the pharmaceutical rep to come in and tell them about the drug. Now we get enough people doing that. Now that's the standard of care. So that's why I'm saying we have got to look at our own profession, okay? And we have to lead and not follow. And it doesn't start from the top down. It starts from the bottom up. And that's why I go and educate patients before I even educate doctors. Because I'm going to tell you, it's twice as hard to unlearn as it is to learn. And I'll tell you, lay people, you talk to them about hormones and why you can't, because they know that blood doesn't work. Believe me, they know the blood doesn't work. Okay. And I see it on social media in my office. You're fooling yourself if you think that the blood work tells you everything you need to know. All right. All right. So this is the problem. We're all high performers. And again, maybe you guys and like me, I have changed what I do. I go in the office 3 days a week. I don't travel. I'm sitting here in my spare bedroom and I'm giving a webinar because I have been there, done that. I have worn myself out. I tell you, I started out, I wore myself from OBGYN. When I was in my 30s, I could get up and do a C-section, sleep for 2 hours, go back to the office, do it all over again. I got in my 40s. It took me 2 weeks to recover if they woke me up in the middle of the night. So in 2006, I said, I can't do this. It's going to kill me. I stopped delivering babies. So then around 2010, that was when we wrote the books and I started traveling. So I did that. And then one time I went to A4M and I was the first person to speak. And I had just gotten off a plane. I was out in Las Vegas. I had been in the office the day before. And I got up and I was ready to do this lecture that Dr. Clearfield and whoever else has heard me. It was about hormone replacement by the book. And I took Spiroff, the GYN endocrinology book, and I explained hormones. And anyway, so I looked at those slides and it looked like somebody had changed the slides on me. And I said, wow, I don't know what's going on with me. And because people had heard me before, and will tell you, so I went up there, I saw those slides, and about halfway through, I said, I don't know what's wrong with me. I really can't focus. It's like somebody's changed my slides. I really can't do this. So people had heard me before. I uh, left. I mean, I went out in the lobby just trying to gather myself, and people followed me because they thought I'd had a TIA. And this was in 2000, I don't know, 14, I guess. And they thought I had a TIA. And so I went home. They called my wife. I left early. And my wife said, you're not traveling anymore. I did a saliva test. My cortisol was shot. It took me 6 months to recover. And this was before I was doing IVs and NAD and all this stuff. And so I've been there, done that. And I'm not going to let that happen to me again. All right. So the biology of high performance, why resilience fades, why standard labs miss it, and how to restore your adaptive capacity. High performance is not lost overnight. It simply becomes more expensive. So what happens is you continue to function and you think that everything is okay, but really you're wearing yourself down. So this is the saliva test. And you see, this is from January of 2026. So, I don't have to go far to get a slide. Now, this is saliva cortisol, okay? So this green area is normal. All right. So am I making these red marks? Can
Uh,
somebody
I don't think so.
I don't think so, but
I think they're already there.
No, it
yeah, I
just
think they
happens
were there.
sometimes. Yeah.
yeah,
Yes,
okay. All right, I'll just make
you
sure I
are
wasn't
doing
doing anything.
that. You are
Beg
doing that.
pardon?
You are
Okay.
doing that because it's from the screen.
Okay. All right. Well, if it doesn't distract you guys, like I said, they're showing up all
No,
over
we're
the place.
good.
Anyway, let me get through this. All right. So this is cortisol. So this is the normal range. All right. Cortisol high in the morning. Your energy dissipates over the course of the day. This is noon. You eat lunch. You get a little bit more energy. Now this is evening. You eat dinner. You get tired. You go to sleep, and it's supposed to happen. Come back. The next day. This is this patient. Okay, she's pushing herself to the rim. Okay, morning cortisol greater than 400. This woman is stressed. Okay, and she's a real estate person. She's doing all these things. And I told her, hey, look, See, this is phase one. So this is what happens. And you can do this. This is probably where I was when I was delivering babies and getting up and, needed 2 hours of sleep and all that. I was up here. Okay. So then what happens is that you cannot stay up there for very long. So what happens is you end up being like this, and I'm going to show you some other examples. You end up being like this. So it comes down, and so now you have this tired and wired where now your cortisol is like this because it says, hey, look, if you keep this up, you're going to wear yourself out quickly. So it becomes fatigued, and it comes this straight line where in the morning you have this much energy and you should have this much. And at night you have this much energy and you should have that much. And so in the morning you wake up and you're tired, even though you have slept, and you fill in this gap with carbohydrates, with caffeine. And this is why Starbucks is a $1 billion company, I think, because people wake up with low morning cortisols. And then they drag themselves during the day. And then at night, they're saying, I've been tired all day, I pushed through work, and now it's night. I either have trouble falling asleep or I wake up at 2 or 3 o'clock in the morning. And so I'm going to show you that this is not some rare occurrence. Okay. So this, again, this is all from January and December in my office. I don't know where these red lines are coming up from. But I just want you to see, this is the first one that I showed you. This is a cortisol curve. This is a disrupted cortisol curve. You can see that she wakes up. She doesn't have the energy she should. She has in the middle of the day, she gets energy, and then at night is way up here. I guarantee you she has trouble falling asleep. And if she does fall asleep, she wakes up at 2 or 3 o'clock in the morning and can't get back to sleep. So here's another example. See, all of these are from December and January. All right. And I can show you some from January and February. This is not a rare occurrence. This is the 75 to 90% of people who have cortisol issues. They're right here in front of you, but you don't see it if you don't measure it. And you can't manage it if you don't measure it. All right. So, and this is a person I saw, this is from January. This is from a high performer. This is a 54-year-old. She's a lawyer. She's some kind of financial person. Her husband had a stroke. She was coming to me for weight loss. And I said, look, she wasn't losing any weight. I said, look, you cannot diet and exercise your way past a hormone problem. I said, we have got to test your cortisol. And this is what we've got. This lady was totally burnt out. So how do I treat her? I treat her with IVs of vitamin C, B5, B6, NAD, magnesium, zinc, selenium, all of this to try and get her back online. And so here's my four-pronged stress treatment. Number one, if at all possible, get rid of the stress. Whether it's a relationship, a job, whatever it is, get rid of the stress. Whether it's a food sensitivity, whether it's some other, glucose dysregulation, get rid of the stress. If you can't get rid of the stress, you have to change how you respond to the stress. You have to get somebody to help you. You have to meditate. You have to change how you're responding to that stress. You have to move your cubicle to someone who doesn't irritate you or whatever. You have to change that. All right. Then the third thing you have to do is repair the damage caused by the stress. And this is all the damage. So you got to repair the gut. You have to repair the neurotransmitters. You have to do all of that. You have to repair the damage caused by the stress. And then we have to build up your resiliency so that you can be prepared for future stress. So you can adapt to situations. You can go back to being able to do the things you could do when your cortisol was normal. All right. And so we see that in high performance, and I know it because I've been there, done that. And now I know better. I know to get rid of my stress, which was 2 days in the office, change how I respond to the stress. I meditate now. I hate that when I wrote the stress connection, I didn't understand meditation. I will not go a day without meditation. Now I'm doing a thing called quantum breath work that I get off of Gaia channel. Incredible. I've been doing this breath work, and you're talking about DMT. You can stimulate DMT with breath work. So I know all about, I know about DMT. I don't know about ayahuasca, but yes, DMT you can get from ayahuasca, but you can also generate it by stimulating your pineal gland. These are all things that I've learned since I've gotten out of line, you guys. I'm way out of line now. You thought I was out of line before. I'm so far out of line now, I don't even know where the line is, you guys. So cortisol is not the villain. Cortisol is capacity. So Cortisol gives you focus, drive, adaptability, emotional containment. People think when they feel like this, oh, I know my cortisol is out through the roof. No, your cortisol is not through the roof. It's low because you don't have focus drive. That gives you when it's in the daily pattern, it does wonders. But when that curve is screwed up, it can screw up your life. So you don't want low cortisol. You want responsive cortisol. We want that when that predator comes, that glucose shoots into your system, okay? And you handle that stress. And then that stress is over with, and then you go back and relax. So you cannot lead without the biological fuel to adapt. And doctors, we have to adapt. We have to adapt to all of this, all of the things that are going on. We have to deal with insurance companies. You have to be adaptive. You change from an insurance-based practice to a cash-based practice. So it's all about, can I adapt to this rapidly changing world? I had to adapt. Dr. Clearfield, you probably remember this information, but hey, I've adapted. I use Notebook LM to make my slides look prettier.
They
Okay.
look good.
So now, beg your pardon, hello?
They look good.
Yes. Oh, I thought you have a question?
No. I was just, you
Okay.
said you made
Yeah.
Notebook LM, and I said they look pretty good. Mhm.
Yeah. Yeah. Well, yeah, I
And
used
you managed,
it.
you managed to get the watermark off of there too. I see.
Yeah, well, it's still up there. I couldn't. So, but anyway, I'm like, now I can do this, and it's a lot easier because of AI, and I can, and all of this information that I've gained over 30 years. And I have so much stuff on my computer. I have to keep up, increasing the capacity of it. But now I'm able to organize it. I'm able to do all kinds of things with AI. And I'm like, wow, this is something I've been trying to get across to people for 25 years. And AI and the way we do Zooms and all this stuff has just made it so much easier. So it's allowed me to get back in it without climbing back into that hole of overperformance and stressing myself out. I can do what I want to do, and I don't wear myself down like I did before. Okay. I'm 65. I can't do what I could do at 40 and 50 when I was around speaking at A4M and all that stuff. I just can't do it anymore. I don't want to do it anymore. I want to get this information out, but I don't want to do it the old way. I want to do it the new way. And that's another thing about as you get older, you still gotta keep your mind. I hang around young people, you guys. I don't hang around old people. Okay, it's just so anyway. So now this is screwed my. I have to. It broke up my words, but health is a rhythm. It's not a number. The pulse is what allows you to lead during the day and repair at night. If you lose the rhythm, you lose your shield. So the real question is: are we measuring what is easy? Are we treating numbers? Are we reflex mechanisms? Are we restoring physiology? Stress dominance is not a failure, it's a biological allocation. When resilience fades, the system has shifted. It's really not broken. So, I didn't know how much time we had. I just wanted to get this across. And hey, look, if you want to ask questions, I can pull up other information. We can talk about other things, but for now, this is all I had. I just wanted to give you guys an overview, and I wanted to see where we are, and I always like to know uh, who's in my audience, and I see we have a lot of people. I see we got doctors, we got all kinds of things. But hey, I'm open to questions. If you want me to mention something else, Dr. Clearfield, I can.